a health concern affecting 3 out of 10 people over the age of 75. What am I talking about? Congestive heart failure.
Dr. Sumant Lamba is part of the team at First Coast Cardiovascular Institute, and he's here to tell us what symptoms to look out for and how this condition can be treated. Welcome, how are you?
Well, wonderful, thanks.
Very good, it's good to see you. So how bad is congestive heart failure right now in our society?
Well, you need to understand that it really is the culmination of all heart diseases. Okay, so if any kind of heart disease, you end up having congestive heart failure, which is not a good thing to have. Now, let me throw some numbers at you, okay? And these numbers appear to be underestimated. So in the United States alone, there are upwards of 3 million people with diagnosed congestive heart failure, 20 million in the world. There are about 660,000 new cases diagnosed each year. But that's not the scary part. The scary part is that if you get admitted to the hospital with heart failure, the chances that you may not be alive at 1 year ranges from 27 to 34%, depending on the type of heart failure you have.
Wow.
And why is that? Is this because they're not changing their lifestyle once they're diagnosed?
Are they diagnosed?
Okay, so again, let me throw some numbers at you.
Yeah.
There are about 50 million people with known hypertension in the US. Half of them don't even know they have high blood pressure. So diabetes, high blood pressure, these are, for lack of a better word, silent killers. You don't really have symptoms if your blood pressure is high. If you have high blood pressure for more than 15 years, your heart either becomes very stiff or weak.
Well, and that kind of brings us into our next question, and that is, what are people doing that are causing the congestive heart failure? What are the risk factors? What are things that we can prevent sitting at home watching this right now so that we don't wind up in one of those statistics?
Our lifestyle. You know, do you know what the average salt in an American diet is?
Don't ask her.
Yeah.
She adds salt to everything before she tastes it.
That's not necessarily. I like
Most
salt.
of the time.
But really, you know, salt intake, sedentary life, you know, our diet, the prevalence, incidence of hypertension, obesity, diabetes is increasing. We're doing a good job of making people live longer. You know, we're treating heart attacks and valvular heart disease, not necessarily improving quality of life. You know, people are living longer, and something I want to talk about is elderly people who are oftentimes short of breath and are told, hey, your heart is strong, your lungs are fine, and this is in your head, or you're physically deconditioned. That is not true.
So this is really something that we should start paying attention to when we're younger. We shouldn't wait until we're, you know, in our 60s, 70s or whatever and start having these symptoms, but we should start this sooner, start paying attention to these things and adjusting our lifestyle.
Well, absolutely. As you know, my partners, I think, mentioned earlier on this show itself that there should be annual blood pressure checks for kids in every class. I mean, the process of vascular resistance and plaque buildup in arteries starts at a very early age. It starts in teenagers. And over a period of time, you know, 10, 20 years is when it starts manifesting.
Well, I was going to say, teenagers, you wouldn't think that you need to get your blood pressure checked to be thinking about something like that. But
this could be hereditary.
You mentioned a stiff heart a second ago. What does that mean to have a stiff heart?
So most people think that if you have heart failure, your heart is weak. So the heart is shaped like a football, and when a heart becomes weak, it progressively enlarges and becomes a basketball. That is only 50% of the kind of heart failure. The other kind of heart failure is when you have a stiff heart, okay, which means that there's impaired relaxation. The heart doesn't relax enough, either because the heart muscle is thick or the resistance is increased. So it doesn't accommodate enough blood, so the blood is not going to go forward, you're going to be tired, and if it backs up, you're going to be short of breath. And there are your symptoms. You're going to be tired and short of breath, initially on exertion and later on doing minimal activity.
And with advancements in medicine and everything, is there something that we can do now? If we do find we have a stiff heart or any of these symptoms that you've talked about, congestive heart disease, what can we do and what are the new treatments?
I haven't given you very good news yet, have I?
No, I want some good stuff. I'm searching.
So I've got to be truthful. You know, we've come a long way in treating weak hearts. So, between optimal neurohormonal blockers, without getting too technical, but blunting the effects of hormones that cause heart failure, and newer pacemaker-like devices, we are helping people with weak heart muscles live longer. But unfortunately, we have no treatments available for stiff hearts except to prevent it. And we go back to all those things: hypertension, weight, diabetes.
So controlling those things.
And a bunch of studies that are ongoing, and we hope will come up with something. Having said that, for weak hearts, we are doing all kinds of clinical trials, and the one that's most exciting is injecting genes into arteries and into the heart to help the heart muscle get stronger. And we have that technology available at First Coast Cardiovascular and at Memorial.
All right. Well, thank you so
Thank
much
you.
for being
Yes.
here. We appreciate that. And of
Great
course, we
info.
want to thank First Coast Cardiovascular Institute, of course, for sponsoring this segment. And remember to know your body, know your risk factors, and work with your doctors to address them.
If you want more information about congestive heart failure from First Coast Cardiovascular Institute, just visit firstcoastcardio.com or call 904-493-3333.
I'm going to limit my salt intake.
Yes, please.
do
That's
like
what I
salt.
was trying to get to. I wanted to
I
make sure that you just went,
got
okay,
it.
let me taste it first, and then I'll add salt if I
Okay.
need to.
I'll do that.
All right, thank you.
tomorrow.